Well, I was in the military, and I really hadn't considered a career in medicine. I was in the Navy, and my job had nothing to do with medicine. I was a Navy SEAL, um, something I'd wanted to do since I was a kid. It's probably the best, most wonderful experience you could imagine. But I knew it wasn't something I could do my whole life. You kind of get shelved, and as you get much past 30, as far as going out and running around the world. But I kept getting hurt. Spent a lot of time in the hospital, all orthopedic type things. My college roommate became a neurosurgeon, and I was going to get out of the Navy. I never planned on being a career person. I did 8 years, and he kind of talked me into medicine over the course of about 2 years. Just steered me in that direction. He also steered me toward neurosurgery. When I started medical school, I didn't want to advertise I want to be a you don't walk in and say you're going to be a neurosurgeon or want to be, but that's what I wanted to do. I actually went and saw the chairman of the neurosurgery department where I went to medical school, and he gave me some direction to work on for 4 years before I applied. The spine center, which we've developed over there, I don't know any others in the area that do anything like it. People with surgical issues that we see, I can't imagine a team doing it better. We're honest with patients. We do not seek out surgeries to do. Trust me, we have more people than we need for surgery. I'd like to get home early sometimes. When we recommend non-surgical care, which we pretty much do for anybody who comes to us first, we want them to do conservative management or non-surgical treatment for as long as possible before we even consider surgery. There are some surgical issues, though, that prevent us from doing that. When people have severe pain or paralysis or things where we want to get them into surgery quicker. But generally speaking, we want a comprehensive non-surgical management plan before we consider surgery. When we make recommendations for surgery, it's generally the last option. Probably 10 to 15% of my referrals, can I help with a surgery? There's not one surgery for every patient. You do have to take into account, how old the person is, what type of lifestyle they have, what their expectations are. I would treat a 85, 90-year-old person much differently than a 30-year-old with a similar problem. The 35-year-old's going to live a lot longer, going to be much more active than a 90-year-old. The 90-year-old's not going to need a Ferrari, but the 35-year-old may. So every person we have to look at individually. We have to take into account all of those things. I am able to separate it, but it's hard, especially living in an area like this. I go to the grocery store, I see patients. I've examined post-operative patients in the grocery store, and you always have to be on your game. You're going to run into someone you want to recognize people, and I generally do. But someone you might not have seen for a couple of years, catch you by surprise. And, it's a wonderful area as far as that goes. But yeah, I try and separate it. I try and keep balance in my life. It's gotten increasingly harder because we've been very busy, and I'd like to get back to some of that balance. I just want people to know I want, as a physician, I want the best for them. I would like them to understand and know that when I talk to them, I always tell them I'm not sugarcoating this. I want to tell them the truth, at least as far as what I feel they need to get better. I have no other interest but them getting better and them improving.